We know that neoadjuvant chemotherapy is now standard of care in muscle-invasive bladder cancer, and we know that it does not impact surgical outcomes. So the AURA trial is a phase 2 multi-center trial testing a neoadjuvant chemoimmunotherapy and immunotherapy with Avelumab in muscle-invasive bladder cancer. So the trial was mainly conducted for oncological outcomes, and the main outcome was a pathologic complete response. And in our study, this was a secondary analysis of the AURA trial, and our objective was to investigate surgical outcomes after neoadjuvant chemoimmunotherapy. So in total, we had 88 patients, and those patients were either cisplatin eligible or cisplatin ineligible. And the cisplatin eligible patients received chemotherapy, either GemCis or DDM-VAC with Avelumab, and the cisplatin ineligible patients received the Avelumab monotherapy. And the aim of our secondary analysis was to compare surgical outcomes between these two groups, to see if adding chemotherapy to immunotherapy will increase complications. So what we have concluded is that first, the rate of complications was comparable between the two groups. So adding chemotherapy to immunotherapy in the neoadjuvant setting did not influence the rate of complications. However, the rate of high-grade complications, so Clavien-Dindo higher or equal to 3, was superior in the combination group, so chemo and immunotherapy group. However, this did not impact neither the transfusion rate nor the ICU admissions nor the hospital length of stay. So we had high-grade complications, same rate of complications and same hospital length of stay. And then in our logistic regression and secondary analysis, we found that, in fact, patients who had a neobladder had 10 times higher complications with odds ratio of 10 to have complications compared to those who had the Bricker urinary diversion. So that was really interesting, because we know now that patients who should receive combination therapy, we should be really we should pay attention that these patients, we should probably more prefer Bricker diversion in these patients compared to neobladder. The second conclusion was that robotic surgery had less complications. Patients who had a robotic surgery had less complications compared to those who had open surgery. So that also was the second conclusion. So to conclude, in general, we have two key take-home messages. The first take-home message is that neoadjuvant chemoimmunotherapy leads to high-grade complications compared to Avelumab monotherapy. And surgical factors matter, so we should prefer Bricker urinary diversion in these patients, and we should prefer robotic surgery.